Suicide in the state are at an all-time high, but a bill in this winter's session is trying to bring some of those numbers down. KX News' Lauren Davis talked with one of the lawmakers behind the bill who says she wants to form a group to try and understand suicides and try and prevent them.
House Bill 1390, if passed, would establish a Suicide Fatality Review Commission to address the growing number of suicides in North Dakota. And according to Representative Carla Hansen, the purpose is to prevent any and all suicides in the state.
If you look at the numbers of people who have died by suicide, North Dakota is at an all-time high. We had 159 people die by suicide in 2022. And even if you look at these numbers adjusted by population, North Dakota also has a very serious problem for suicide. We're 14th worst in the nation.
If the bill makes its way through and is signed into law, the executive director of the North Dakota Department of Health and Human Services would be in charge of choosing who could be on the commission. Members could include mental health professionals, law enforcement, tribal nations, and schools, among many others. Hansen says the commission would look at cases and see if it could be addressed beforehand with policies, practices, and services.
What was happening in those individuals' lives 30 days, 60 days, 90 days before the death happened. And they would look for things that didn't happen or should have happened, and look for protective factors and risk factors.
Hansen says she's a part of a coalition in Cass County to prevent suicide, and she thinks a statewide organization could make a big impact.
So part of our coalition's work, we are looking at how we can make a bigger impact with suicide prevention. And one of our ideas was to expand this type of work to the entire state of North Dakota.
Hansen says if anyone is experiencing a crisis, they can dial 988. For KX News, I'm Lauren Davis.
House Bill 1390 has already passed through the House chamber, and the bill is now being considered by the Senate. So far, they have not voted on the matter.